Hi, Ruben here and welcome to Anatomy Movement, where anatomy becomes funatomy. We have summarized and detailed notes, acronyms, HD images to build your photographic memory, X-rays images, tabled notes and questions and answers at the end of each video to help you remember all that we have learned. Without further ado, let's dive into today's topic. The popliteal fossa. The popliteal fossa is a diamond-shaped area located on the posterior aspect of the knee. It is the main path by which vessels and nerves pass between the thigh and the leg. In this video, we shall look at the anatomy of the popliteal fossa, its borders, contents and clinical correlations. Borders. The popliteal fossa is diamond-shaped with 4 borders. These borders are formed by the muscles in the posterior compartment of the leg and thigh. Superomedial border, semimembranosus. Superolateral border, biceps femoris. Inferomedial border, medial head of the gastrocnemius. Inferolateral border, lateral head of the gastrocnemius and plantaris. The floor of the popliteal fossa is formed by the posterior surface of the knee joint capsule, poplitis muscle and posterior femur. The roof is made of up 2 layers, popliteal fossa and skin. The popliteal fossa is continuous with the fossa lata of the leg. Contents. The popliteal fossa is the main conduit for neurovascular structures entering and leaving the leg. Its contents are medial to lateral. Popliteal artery. Popliteal vein. Tibial nerve. Common fibular nerve. Common peroneal nerve. The tibial and common fibular nerves are the most superficial of the contents of the popliteal fossa. They are both branches of the sciatic nerve. The common fibular nerve follows the biceps femoris tendon, traveling along the lateral margin of the popliteal fossa. The small saphenous vein pierces the popliteal fossa and passes between the 2 heads of gastrocnemius to empty into the popliteal vein. In the popliteal fossa, the deepest structure is the popliteal artery. It is a continuation of the femoral artery, and travels into the leg to supply it with blood. Clinical relevance. Swelling in the popliteal fossa. The appearance of a mass in the popliteal fossa has many differential diagnoses. The 2 major causes are Baker's cyst and aneurysm of the popliteal artery. Baker's cyst. A Baker's cyst popliteal cyst refers to the inflammation and swelling of the semimembranosus bursa, a fluid-filled sac found in the knee joint. It usually arises in conjunction with osteoarthritis of the knee. Whilst it usually self-resolves, the cyst can rupture and produce symptoms similar to deep vein thrombosis. Popliteal aneurysm. An aneurysm is a dilation of an artery, which is greater than 50% of the normal diameter. The popliteal fossa, the roof of the popliteal fossa, is tough and non-extensible, and so an aneurysm of the popliteal artery has consequences for the other contents of the popliteal fossa. The tibial nerve is particularly susceptible to compression from the popliteal artery. The major features of tibial nerve compression are weakened or absent plantar flexion, paresthesia of the foot and posterolateral leg. An aneurysm of the popliteal artery can be detected by an obvious palpable pulsation in the popliteal fossa. An arterial bruit may be heard on auscultation. Other causes. Rarer causes of a popliteal mass include deep vein thrombosis, adventitial cyst of the popliteal artery and various neoplasms such as rhabdomyosarcoma. Now let's have a quiz. 1. Which muscle forms the superomedial border of the popliteal fossa? Medial head of gastrocnemius, semitendinosus, biceps femoris, semimembranosus. The correct answer is semimembranosus. 2. Which of the following is the deepest structure in the popliteal fossa? Tibial nerve, common fibular nerve, popliteal vein, popliteal artery. The correct answer is popliteal artery. Thanks for watching. Like and subscribe to Anatomy Movement channel for more.